Recently, there was a study that got a lot of press that was looking at women who had taken GLP-1 agonists to lose weight. And then later on, they had become pregnant. And basically, they were looking at the impact. And so, before attempting to get pregnant, women generally would stop GLP-1 agonists at least 2 months before because there's a washout period. And so, these women had done that and they weren't on GLP-1 agonists when they got pregnant. But they were looking at it versus women who had not taken any GLP-1 agonists. And they saw the women who had taken GLP-1 agonists were more likely to put on more weight during pregnancy, as well as more likely to have preterm delivery, gestational diabetes, gestational hypertension, high blood pressure, and preeclampsia complications versus women who had never taken GLP-1 agonists. Now, this is more of a yellow flag versus a red flag because we don't know, if those women had never taken GLP-1 agonists and they had gone into pregnancy at a higher weight, would they have these same complications? Would they have worse complications, or would they have less complications? We don't know. This study was looking at women who had never taken GLP-1 agonists versus women who had. But it is interesting information in that, there aren't a lot of studies looking at this because GLP-1 agonists are new medications. And so it's definitely something to think about if you are taking GLP-1 agonists and you're planning to get pregnant at a later date, that, you would need to really aggressively monitor your blood pressure and blood sugar to, try to avoid getting, high blood pressure, gestational high blood pressure and diabetes complications, because that could be one of the impacts of taking GLP-1 agonists. We don't know yet. More studies will need to be done, but it's possible that could be one of the impacts.